My dear students, welcome to the last YouTube session of this month. So let's do the routine drill. Can you all hear me loud and clear? Let me know. Can you hear me? Today we will discuss 10 MCQs from the topic physical chemistry. Good. So it seems you are able to hear me. So let's begin with the first MCQ. Which of the following structures represents the conjugate acid of HPO4 2 minus? Hi 7th Hokage, been a long time. How are you doing? Are you still watching the Boruto episodes? Nitish Kumar, welcome. So, identify the conjugate acid. Give me the answer. This is the conjugate acid for this. So, this is to test your knowledge on conjugate acid and conjugate base. I hope you are all aware of this term, conjugate acid, conjugate base. So what is a conjugate acid? If you add H, you are going to get what? Conjugate acid. So HPO4 2 minus, you are adding a H, so it will become H2PO4 minus. Clear? So this is conjugate acid and conjugate base. So whenever you write a buffer, what will you always do? Conjugate acid and base. You always mention, right? Clear? So what is the answer for this? So the answer for this is pKa. Okay, so a buffer will be most effective at its pKa, but what is then pKa plus or minus 1? pKa plus or minus 1 is the effective range. Okay, so that is the effective range of buffer, whereas the most effective, if they are asking, the most effective will be at its pKa. Okay, let's go to the next one. So which of the following is the most important buffer in the extracellular fluid? Which is the most important buffer in the ECF? Tell me. Is it bicarbonate, phosphate, hemoglobin, or protein? So tell me. So which one? So excellent, excellent. The answer is Ravinder Khatri. Nice. So the answer is bicarbonate. 7th Hokage. Nice. So bicarbonate buffer is the most important buffer in your extracellular fluid. If they are asking you which amino acid, okay, no issues. I think that that network issue is from my side, not from your network. Don't worry. Hmm. So let's proceed. So that one question you might have missed, not an issue. So the ones who will watch the video later, I think they will be able to see that question. Hmm. So look at this. Hmm. So when they are asking you which of the following amino acid is responsible for the buffering capacity, the answer will be what? Histidine. Buffering capacity of proteins, hemoglobin, it's all due to histidine because of the pK value of histidine is 6.1. So okay, so that's why that has this question answer. Which of the following buffer is known as open end buffer? What is this term? New term, open end buffer, and which is the open end buffer? So tell me which buffer is open end buffer? Answer. Yes, bicarbonate buffer is the open end buffer. Bicarbonate buffer is said to be open at both the ends. How? So you see, bicarbonate can be exhaled as carbon dioxide, right? So one of the component, it can be exhaled, and H plus is excreted in the urine. So normally the pH of the urine is acidic, right? So normal pH of the urine is it's acidic pH. So the components of bicarbonate buffer can be regulated at the both the ends. So that's why it's known as open end buffer. Okay, interesting question, right? So guys, I will take this opportunity to introduce NEET PG T20. So it's a mixed bag of 20 clinical questions. So immediate detailed results will be available, and every day at 10 p.m. you have this. Now there are some exercises you have to do. Calculate the pH of a mixture of zero point 0.1 molar acetic acid and zero point 0.1 molar sodium acetate. pK is this. So try to calculate this. What is the Henderson-Hasselbalch equation? pH equal to pKa plus log salt by acid, right? Just use this equation and calculate now. What is the pKa? pKa is 4.76 plus log. So 0.1, 0.1. Okay, so this concentration, this is not required, just log 0.1, 0.1. So log 1 is 0, so the value you will get is 4.76, right? The answer will be 4.76. Let's move ahead. Anion gap represents which of the following? 7th okay, excellent, you are doing well. So what is anion gap? What is the meaning of this? Is this a gap in anion molecule, or is it a difference between high and normal anion gap acidosis, or is this due to unmeasured anions present in plasma, or is it due to primary deficit of anions? What exactly is anion gap? which is the major positively charged ion, is your sodium. Sometimes you can even omit the potassium, right? Hmm. The major one, chloride, right? So chloride, you can take even bicarbonate sometime. It all depends. Hmm. So when you measure the anions and cations, you expect it to be equal in the blood. Okay, because electroneutrality should be maintained, right? The concentration of anions should be equal to concentration of cations, because when you touch the blood, you don't get any electric charge. So our blood is neutral, right? So electrically it's neutral, right? So concentration of anions should be equal to cation, but when you measure, you don't get that. There is some difference, not option B. So this is high and normal anion gap acidosis. This is not correct. So there is some difference between the this one. So anion and cation. So that is because of the unmeasured anions present in the plasma. Okay. So what are the unmeasured anions present in the plasma? Mostly proteins, then sulfates, okay, some organic sulfates, all these things, right? So negatively charged, right? So proteins are negatively charged. So anion gap refers to unmeasured anions present in the plasma. Very important, don't get confused by the other options. Let's move to the next one. High anion gap is found in all of the following condition except, so there are a lot of mnemonics for high anion gap mnemonics. So one is like mud pile, and there are other mnemonics. Look at this. Which one is not associated with high anion gap? So we differentiate acidosis based on either high anion gap or normal anion gap, right? The main use of anion gap is to differentiate high anion gap acidosis and normal anion gap acidosis, because the management of this acidosis is going to be dependent on the anion gap. So look at this, uremia. So you have urea, so it's going to be there, going to accumulate. Hmm? Lactic acidosis, it is lactate, it's negatively charged, right? So it's going to be accumulating. Methanol poisoning, it's also going to increase the anion gap. So in the mud pile, you have M, U, right? LC mud pile. So all the components of mud pile is there except renal tubular acidosis. Renal tubular acidosis is going to have normal anion gap. Okay, another classical. These are all the classical MCQs. Classical questions. It's going to have normal anion gap acidosis. So I will take this opportunity to introduce iconic subscription of Unacademy. So now PrepLadder is a part of Unacademy. So with this, you get lot of features. When you have the iconic subscription, you will get recorded video lectures, question bank, and access to rapid revision and handwritten notes. So if you are a plus member, you can think about updating yourself into iconic subscription, or if you are a new one, you can also think of getting directly the iconic subscription. You can also use this code to get 10% instant discount. So we have talked about high anion gap and normal anion gap. Is there any condition in which you will have a reduced anion gap? Tell me, is there any condition in which you have reduced anion gap? So Nitish Kumar, you are correct. In GI laws like diarrhea and all, there also you will have normal anion gap. So where will you have reduced anion gap? See, starvation, ketosis. There will be keto acids accumulating. So what are the keto acids? Hmm? What are those? Acetoacetate, beta hydroxybutyrate, negatively charged. Salicylate, it's also negatively charged. It's going to increase the anion gap, right? Hmm? It's going to increase the anion gap. So it's not known that hyperalbuminemia will going to increase or decrease the anion gap. Okay, but it's known that multiple myeloma is associated with excellent uh, Abhibruddhanya Varna, excellent. James Vijay, good, good. So, multiple myeloma is associated with reduced anion gap. Okay, the reason, let me tell you, uh, the gamma globulins which are increasing, right? Usually, proteins are all negatively charged, but gamma globulins are positively charged. This may be another new information for you. So today we are learning a lot of new things. Gamma globulins are positively charged. Okay, this is the reason. Now try to calculate the isoelectric pH. What is the isoelectric pH? What is the isoelectric pH? Isoelectric pH is the pH at which a molecule will carry the net charge of 0. Okay, so you should not say that the molecule is uncharged. It's not the case. Molecule will have a charge, right? So the net charge will be 0. That means it's going to carry equal number of positive and negative charge. How to calculate the isoelectric pH? Hi Neeraja Kundeti, welcome, good to see you. How will you calculate the isoelectric pH? You have to see the either side of the zwitterion. Okay, see the either side of the zwitterion. So pK1, pK2 or 3, something like that. So it can be pK2 and 3 also. Hmm? So always you have to see the pKa on either side of the zwitterionic form. Okay, so here for phenylalanine, how many ionizable groups are there? There are just two ionizable groups, right? Just COOH group and the uh, an amino group. Good evening, Neeraja. So, how is your PhD going on? I hope everything is fine there, right? So, you have just two ionizable group, so it's very easy to calculate here. So, it will be like, so here in case of phenylalanine, it's very simple. Isoelectric pH is equal to pK1 plus pK2. Good to know, Neeraja. So pK by 2. So it will be like 1.83 plus 9.13 divided by 2. Clear? So how much? What's the value you will get? Tell me. So it will be 10.96 divided by 2. So that will give you here be 5.48. Clear? Okay, good. So let's move ahead. What do you infer from the decrease of pH value from 7.35 to 6.35? So what is pH? Very basic question. pH is the negative logarithm of hydrogen ion concentration. Okay, so that is the pH. Abhipranya, thanks for your compliments. So in YouTube, we just do a very small discussion and all. So what you can do is go to our YouTube app, in, not YouTube app, our Unacademy app. So go to our Unacademy app. There you will find at least some 30 hours of free classes I have taken. So there you will find 30 hours of free classes. Okay, they are all free. Please watch all those videos. It will be really useful. Abhibridrinya, what are you doing? Are you first year MBBS students or doing internship or something like that? So in which level of medical career are you? Tell me. So when the pH uh, from the decrease of pH value from 7.5 to 6.35. So what will be the answer? Otherwise, just think that 7 to 6. What's going to be there? So if the pH is decreasing, if the pH is decreasing, that means the hydrogen ion concentration is going to increase. Clear? Because it's the negative logarithm, right? So if the pH is decreasing, H plus is going to increase. So excellent, Neeraja, Madhuri. It's like going to be tenfold increase in the H plus. Okay, right? Priyanshu, welcome and correct answer. Good. What is the physiological pH? The physiological pH is maintained in a very narrow range of 7.35 to 7.45. Okay, the very narrow range of this. Okay, good. So the average is your 7.4. But this is the very narrow range we have to maintain. Why do we maintain the pH? What is wrong? The problem is when the pH is altered, all the enzymes, all the proteins, they have particular pH, right? So when pH is altered, all the enzymes and all their functions will be affected. Okay, so that is the very important reason. The pH is gone, your enzymes will stop acting. Okay, so that's the thing. So then, is there any doubt for any of you? Any doubt, any question? Ask me whatever doubt you have. Any other doubts? So in ABG, before taking the arterial blood gas, tell me what test you have to do. Let me ask some question. So before taking arterial, actually I have I have given the signal to you before taking arterial blood gas. Which test you have to do in the patient to check the competency? Excellent, excellent. What is? Do you remember the name of that test? Will you check the competency. Excellent. It's a modified Allen's test. Okay. It's a modified Allen's test. Good. So good that you are remembering. Okay. So before doing, if you are taking in the radial artery, you have to take, you have to do this test to check the competency. So once you take the sample, you have to keep that site under pressure for at least 10 minutes because this is an artery, right? So this is arterial bleed. Okay, so it's not going to stop immediately. So this is another thing. So when you take normal venous sample and all, peripheral venous sample and all, you take the sample, you tell the patient that okay, 2-3 minutes you just keep it pressed. Okay, then that will stop. But in artery, after you taking the blood sample, you have to take at least minimum at least 10 minutes. Okay, clear? So you have to apply firm pressure. You tell the either patient, if the patient is not there, attendant, no one is there, you have to do that. Okay, 10 minutes you have to give firm pressure. This is one point. So in ABG, if you see the ABG and all, so how do they do ABG? There will be an ABG machine. In that ABG machine, there will be electrodes. There will be electrodes. So these electrodes are ion selective electrodes. These are what? Ion selective electrodes. So they will be permeable to particular ions. So there will be an electrode for pH. There will be an electrode for pH. Okay, and some ABG machine they will also measure sodium, potassium also. So that facility is also there. So pH, for pH you have an electrode. This carbon dioxide concentration and all, right? So PCO2, bicarbonate, these two are related, right? So PCO2 and bicarbonate are related. So PO2 you measure, but bicarbonate can be derived from PCO2. So you don't have electrode for everything. So this also you need to understand. So that ABG machine, it's going to calculate. Okay, ABG machine is going to use calculate. So there are two kind of parameters. So the parameters which are actually measured, so measured parameters and calculated parameters. So this parameters, so this you should be aware in clinical laboratory. In clinical laboratory, most of the things you have measured parameters and calculated parameters. Let me give you one more example so that you will understand it. For example, LDL cholesterol. Do you think LDL cholesterol is measured or calculated? Tell me, guys. LDL cholesterol comes under which category? What about VLDL cholesterol? VLDL cholesterol, do we directly measure or we do this? So I hope you are all aware of this, right? So there is a formula called Fried-Wald formula, right? Fried-Wald formula. Fried-Wald formula, Neeraja. Fredrickson classification is the classification. Manas Tripathi. So this today also they have preponed the class. Today I discussed pH and so sorry that today also I forgot to inform you. So that's why I put in the Telegram group. So please keep the notification of at least our Telegram group. You can mute other Telegram groups and all, at least our Telegram group. So new students, Abhibridanya, so our Telegram group name is Biochemistry with Karthi. Feel free to join the Telegram group and get all the notification. So anyway, all my YouTube classes are done for this month. Okay, so I have completed all the YouTube classes. So there is one Unacademy special class left, one free class left, but I am taking two more classes. For example, on October 30, not October 30, September 30, this month, September 30, I will take two classes. One is I am going to discuss the NEET UG biochemistry related papers. So in the NEET UG, that is MBBS entrance exam, they have asked lot of biochemistry related questions. Okay, so that's why I'm going to uh, uh, discuss all these NEET UG 2020 biochemistry related questions, and also I'll discuss some topics. Either I can discuss something like mixed questions, mixed bag question, all the subjects I can do. So maybe most probably I will do this one, so all the subjects. So many of the students might have come at 7 p.m. thinking that the class is at 7 p.m. So guys, so it was like a surprise for you that they have preponed the class. So any doubts, tell me. If you have any doubts, I'll be happy to solve, if I can solve now itself. Anyone? Don't hesitate, ask me. So whenever you are studying, always try to relate things. For example, you study like a game. So you just start something and do a mind mapping or memory mapping. So look at this. So you start with lactate. You start with what? Lactate. Then you think, so what is lactate? Lactate is coming from what? Pyruvate. Then from where pyruvate is coming? Just think like this. Pyruvate is coming from glucose. Right? Then, so this lactate can go to liver and it can go into Cori cycle. So when you study something like Cori cycle, then what is Cori's ester? Cori's ester is glucose 1-phosphate. Glucose 1-phosphate is known as Cori's cycle, Cori's ester. Okay, so if there is Cori cycle, there should be some other cycle, that is your glucose alanine cycle. What is the name of glucose alanine cycle? It is Cahill cycle. Then just think about pyruvate again. Go back to pyruvate. So pyruvate can become what? Alanine. What are the other fates of pyruvate? Think. Pyruvate can become acetyl CoA. So now let me open OneNote so it will be easy for you. So I can keep on going like this. So you are all able to see this. Okay. Drawing color. There is green is not good. Let me select this and this. Okay. What I was talking about the pyruvate. So pyruvate can become what? Pyruvate can become alanine. Hmm? Pyruvate can become alanine. So this is transamination, and pyruvate can become acetyl CoA. Some issue. The pen. Then it can also become oxaloacetate. This can also become lactate. Now think, what can be the fate of acetyl CoA? What can acetyl CoA become? Acetyl CoA can be completely oxidized in the TCA cycle, or acetyl CoA can also be transaminated. So acetyl CoA on transamination going to produce what? Acetyl CoA on transamination is going to produce your malonyl CoA, right? So like this you do a memory mapping, so multiple things. I don't want to bore you with so many things, so you can do like this, take a big paper and keep on doing this. So it will be a really a game like experience for you to learn biochemistry. So I hope with this we can conclude today's session. So 7:30, yeah, that's what we were discussing. 7:30 IPL is there, many people can go and watch IPL also. And you know that Unacademy is official sponsor of IPL matches. So guys, I'm glad that all of you participated in today's session. So see you on September 30th. So next session will be on September 30th. Feel free to join the Telegram group, so there I will put the notifications. Okay, bye everyone.